And so today is just a wonderful opportunity for us, for you, for our county. I think most of you know what this project is about. A few months ago, we were selected to be a part of a national research project by the National Council on Aging and American Society on Aging. There were only 4 senior services departments or senior centers picked in the United States, and we were one of the 4. And so give yourselves a hand. And so we started this project, and those that participated, but let me back up. So the project is for us to do some research about the drivers of inequity as it relates to obesity. And so with that, the National Council on Aging and ASA, they sent 2 participants down from ASA Rise Fellows to do some questioning and to meet with our seniors, to ask you some questions about what's going on with you and exercising and moving and your thoughts about obesity. Well, I will tell you this, the very first group, we failed horribly, but in a good way. The first 10 people that we interviewed, there were no issues. You told them that your local senior center helps you with anything that you have going on, and that you can come to the staff here at Frank Bailey and they can point you in the right direction. So give Frank Bailey Senior Center staff a round of applause for this. But we also understand that we're not perfect. We're not a perfect senior services department, and we're not a perfect senior center. And we understand that there are some people who come to our senior centers and they may not be getting what they need. And so we did it again. We had another group come in, and we finally were able to answer some of the tough questions from some of our seniors here at Frank Bailey Senior Center. The project yielded us $12,000. Once we complete the project, we will receive $12,000. What we did with the money is we provided the people who participated in the research project, we provided you with a $100 stipend apiece. Even the first 10 that did the survey, you received $100 for participation. We also paid our wonderful moderator, Ms. Lydia Pierre, to facilitate this opportunity for us. And then the rest of the money, we're taking the money back to do some awesome things with our staff. So I'm gonna put a thumbtack right there and say this. We have the absolute best staff in all of Clayton County, and I know I'm probably impartial. So could you give Clayton County Senior Services a round of applause? As a director here at Senior Services, I have learned a lot about you all. I have learned a lot about our county. Our county absolutely loves seniors, and our county really supports the work that we do here in the county to make sure that you have everything that you need and to make sure that you're living your best life, which is my motto. Our staff is amazing. I know I keep saying that over and over, but right now I would like to give a special thank you to Melissa Myers-Bristol. She is the Assistant Director of the department. And to all of our administrators, Jamie Carlington, Courtney Johnson, Elaine Jackson, thank you so much for doing what you do. Our senior center managers who are here and not here, Ms. Wanda, could you please raise your hand? She's the manager at Senior Center. Kendra Shepard is the manager at Sona Singleton Gregory Senior Center. Leslie Collier is the manager at Kinship Care Resource Center. And how could I not forget Ms. Joy Boston, who is the manager here at Frank Bailey. So with that being said, also, we had a big week this week. The American Society on Aging Conference is this week here in Atlanta. So on Tuesday, there were a busload of people that came down to tour Frank Bailey Senior Center just to see what we do, and staff did an amazing job. You did an amazing job with wowing them, so just thank you so much. And so we are definitely going to get started with this. Today is going to be an awesome day. This is being recorded, and the information that we received today will be sent back to the National Council on Aging. What's going to come out of this is, after we finish this and the other senior centers finish their town hall, all of the information is going to be compiled, it's going to be tweaked, and this is actually going to be a toolkit that can be used across the nation for senior centers to really sit down with their participants and find out what are some of the drivers with obesity. So again, Frank Bailey Senior Center, give yourselves another big round of applause. give our wonderful communications department a round of applause. Thank you guys so much for recording this for us. And now I'm going to turn you over to our wonderful Ms. Lydia Pierre, who is the moderator of this event.
Hello everyone, thank you for having me today. My name is Lydia Pierre, I go by the corporate socialite, and I will be your moderator today. Yes, before I go, I would like to have Megan come up with ARC to say a few words. Megan Murphy, who is the program and project analyst at the Atlanta Regional Commission.
Hi everybody, I'm happy to be here today to support this project and support Tori and Melissa and all the great work that Clayton Senior Services does. A little bit about Atlanta Regional Commission for those of you who don't know. We're the planning organization for the 10 counties around the Atlanta region. Specifically, what I do is I work in the area agency on aging part of it. So we handle all of the aging services regionally. So we contract with Clayton County, and we love the work that they do. We give them support as much as we can. So with that being said, I will turn it back. Thank you.
Thank you. Awesome. It's me again. All right, well, real quick, I want to go over a bit more about why we are here, the purpose that we are trying to really bring to everyone's attention and raise awareness around. So I'm going to do a brief presentation on the drivers of inequities and barriers to quality obesity care for older adults. So now when it comes to obesity, it's important that we understand that it's a major public health problem in the United States, and it's especially prevalent among older adults. According to the Centers for Disease Control and Prevention, more than 40% of adults aged 65 and older are considered to have obesity. Obesity is a major risk factor for a number of chronic diseases, which include heart disease, stroke, type 2 diabetes, and cancer. These diseases can have a significant impact on the health and well-being of older adults. Now, there are a number of factors that contribute to the obesity in older adults, including genetics, diet, and exercise. However, there are also a number of social determinants of health that can contribute to obesity, such as poverty, lack of access to healthy food, and lack of safe places to exercise. Now, some of the key issues that we want to address today that are facing older adults that suffer from obesity include disparities in access to quality care. So older adults with obesity are more likely to have difficulty finding healthcare providers who are knowledgeable about and experienced in treating obesity. They are also most likely having difficulty paying for obesity treatment or obesity care. Some of the social determinants of health are that older adults with obesity are more likely to live in poverty, have limited access to healthy food, and live in areas with limited opportunities for physical activity. Now, these social determinants of health can make it very difficult for older adults to lose weight and maintain a healthy weight. Now, when it comes to mental health problems, older adults with obesity are more likely to experience mental health problems such as depression and anxiety. Now, these mental health problems can make it difficult for older adults to also lose weight and maintain a healthy weight. Now, when it comes to physical health problems, those who suffer with obesity are more likely to have other physical health problems. Now, these may be, like we mentioned before, heart disease, stroke, and type 2 diabetes. Now, these problems as well can make it difficult for those who are looking to lose weight and maintain a healthy weight as well. Now, of course, we don't want to just talk about the problems and not talk about strategies that we can put in place to address these issues. So there are a number of strategies that can be used to address the issues facing older adults that are suffering from obesity. These include community-based interventions such as this, because community-based interventions can help to improve access to healthy food, safe places to exercise, and the mental health services that we are talking about. These interventions can help raise awareness and also help build the community support for weight loss and maintenance. Of course, policy changes are a big part of it as well. Being able to talk about these issues can help to improve access to healthcare, make healthy food more affordable, and also help to provide more accessible and safe places in order to exercise. Now, this will require having policy changes, and these can also help to reduce the stigma and discrimination against older adults that are suffering from obesity. Now, I just want to share with you a little bit of data and statistics on obesity that are among older adults that are staggering. For example, according to the Centers for Disease Control and Prevention, the prevalence of obesity among adults over the age of 60 has doubled over the past 20 years. The number one cause of obesity is genetics. That means if you are born to parents that have obesity, you have a 50 to 85% likelihood of having the disease yourself, even if you have optimal diet, exercise, sleep management, and stress management. And this is according to a 60-minute segment on obesity. Also, did you know that 79 to 90% of physicians in the United States have significant bias towards individuals that are heavier? According to a study published by Dr. Stanford, she found that most medical schools don't even teach obesity, that it is a disease, and in fact, they don't even offer courses on it, even though it's the second leading cause of preventable death in the country after smoking. Now, the impact of obesity on older adults is truly significant. Obesity can lead to a number of health problems, which can have negative impact on the quality of life, and it can also increase the death among older adults. Now, when it comes to some of the guidelines that we want to talk about as we're conducting this town hall meeting, we want to be sure that we remember that words have power. We want to be able to destigmatize obesity and why it's important to understand what it is in today's society. We want to make sure that everyone is mindful of their choice of words and that we communicate about obesity in a very respectful manner. We want to remember that obesity is a disease, and we want to avoid referring to individuals as obese, because this is considered to be derogatory. A better way to communicate this is by saying individuals with obesity. This depersonalizes obesity and steps away from saying that obesity is a choice or a flaw. For example, you want to avoid language that relates to weight management and focus on a healthy lifestyle and how one does not have appropriate resources that can achieve this. Now, this topic is heavily focused on equity gaps that have a tremendous impact on older adults of color. We want you to be aware and acknowledge your privileges as well as your biases as you speak. It is important to be aware of both your unconscious and conscious biases. We all have privileges, and acknowledging your privileges is important when having an equity-centered conversation and heavily influences the direction of the questions that you are being asked. Okay? So, with that said, I would like to introduce our amazing panel that we have that is going to be a part of this lively discussion when it comes to obesity and the different things we can do to destigmatize it. All right? So to my right, we have Dr. Enoch Otai, who is the Medical Director of Gen Care Senior Medical Center in Raro, focused on providing seniors with high-quality primary care. Everyone give a round of applause for Dr. Enoch Otai. Thank you for being with us today. To the right of Dr. Enoch, we have Anton Ford. Anton is a personal trainer and a licensed group fitness instructor with Clayton County Senior Services, and he has been providing teaching group fitness classes since 2007, and is certified in this area and is also the program director when it comes to working with those in this area. Thank you so much for being here, Anton. To my left, we have Lamora Poor. She is the owner of the Diet to Lifestyle LLC, which is a nutrition consulting company with knowledgeable, registered, and licensed dietitians who work with children and adults on improving or maintaining a healthy lifestyle. Give a round of applause for Lamora. And next to Lamora, we have Dr. Mark Waterman, MD. He serves as the Chief Medical Officer for Clayton County Fire and Emergency Services. In this role as the CMO, he provides clinical leadership and oversight to the men and women of CCFES. Thank you so much for being here, Dr. Waterman. Now we're going to go ahead and get started. And of course, as we mentioned before, the idea is to help destigmatize the idea behind obesity and inform the community of all of the ways that we can be able to raise awareness and also make a difference and an impact in the community. So first, I'm going to start with a question in regards to that. When it comes to destigmatizing obesity, what types of policies do you feel should be in place within healthcare settings that would help address this? Now, are there any healthcare professionals here today who would have put policies and guidelines in place for this if you had the power to do so? Would like to address that?
Didn't get a chance to test this out. Can everybody hear me okay?
Yes.
All right, very good. Good afternoon. Yeah, so policies in place to destigmatize it. In a healthcare setting, especially I'm working in a senior clinic, one thing that we have instituted is when patients come in, basically everybody gets weighed, right? Everybody, you take your weight, you take your height, we measure a BMI, which is an important vital sign, right? And one thing that we do is that we try to give patients privacy during this period of time. So basically not just have the scale right there in front of everybody else to see it, but give them a private area where they can be weighed. And also, we do have a policy where we don't want people to say their weight out loud necessarily. It's something that's personal to them. And some people might be sensitive about it as well. So we try to be sensitive to that whenever we take patients in and we triage them. So that's one thing that we can do from the clinic level to destigmatize. But a lot of it is just messaging and reinforcing that the fact that it's not something to be ashamed about, and making sure everybody acknowledges that it is a disease, it's a medical condition, as opposed to something that's just a product of some kind of personal choice or a lack of responsibility.
Thank you so much for that. Is there anyone else that would like to address that? Dr. Waterman?
Is it on?
Yes.
Well, thanks. My name is Mark Waterman. I'm an emergency physician and practiced at Atlanta Medical Center before I joined the staff here at Clayton County Fire and Emergency Services. So I have a few decades of experience dealing with patients. At our hospital, we were at what was called a bariatric center of excellence, i.e. we took care of patients who had the medical problem of obesity. Can you hear me now?
Yes.
Okay. So we took care of patients who suffered the illness of obesity. So the biggest issue was really training the staff to understand that we were dealing with a medical problem, just like diabetes or chest pain or stroke or trauma patients. It was just another illness, but we educated our staff on how to deal with that. And that was the first step. And so it made our patients feel comfortable when they walked in the door.
Thank you so much for that. Absolutely. It's very important that we make sure that people feel comfortable, especially when discussing such sensitive issues such as their weight, and understanding that, like you said, that is a medical illness. It's not something that you are guilty of having or experiencing. So a lot of times we want to remove the shame so you can feel comfortable to be able to share that information with their doctor or whoever it is that is their care provider. So that's very important as well. Now, when it comes to biases, for many of us, our implicit biases can rear their heads at any moment. These implicit biases influence how we see ourselves and others in the world. What are some ways we can all change our implicit biases as it relates to our personal health? I'll give that to Lamara.
Hello, everyone. My name is Lamara, and I'm a dietitian. So I also work at Southern Regional Medical Center as well. I'm a dietitian there. So, when we go into a patient's room, we already know what their BMI is, and so we don't address the weight because that's not the important part at the moment. We are focusing on whatever the condition is as far as what's happening with them. And honestly, like my business part is the outpatient portion where I help the patients get to their goals. So if that's not your goal to lose weight or, addressing that, what is actually your reason for being here? What do you want to actually do? What are you waiting for? So you just have to make sure that you're ready for it, and you're, I'm not going to address, what's going on with your condition at the time, unless you want to address that. And so I think that sometimes some certain dietitians, I think sometimes like a lot of people will not really want to come to a dietitian because they're afraid that that dietitian is going to judge, and so that's why we ask them what they want, and we make sure that we are very sensitive to the condition and helping you eating healthier just in general and not focusing more so on weight.
Absolutely. Thank you for that. I'm not sure if anyone else had a response to that. How do you keep your biases from influencing the way that you work with the people who are in need of your services?
Because of the bias, it's so thick you can cut it with a knife. So a lot of people will shy away from appointments or getting out or being around people. So settings like this will help build more relationships, more educational things that they will need so they can be able to not neglect themselves trying to house themselves or stay away from where they think someone will judge them or look at them a certain way. So more settings like this, being open and just addressing the issue and teaching how to better health lifestyle and eating and dressing, things of that nature. So settings like this will open up the door and make people more comfortable.
Absolutely, thank you for that. And to kind of piggyback on what you said, it's important that we also meet people where they are and understand what their backgrounds and influences are. Did you have something you wanted to say?
Yeah, I was just also going to say, I was just sitting here thinking about, at the beginning of my own personal medical training and the implicit bias that I probably had at that stage and how it's evolved over time. And I think it's really just a result of hearing more stories, getting to know people on a more personal level, and understanding what their own personal circumstances were. And once you hear more stories, meet more people, then you start to have a better understanding, and that definitely has a positive impact in terms of eliminating implicit biases.
Absolutely, because as we said, sometimes we're a product of our environment, and a lot of things that are around us are the reasons or contribute to a lot of the things that we can and cannot do. So it's important to understand that meeting people where they are is really important. So as it relates to that and relates to addressing issues and challenges in their lives, can you all share what this would actually look like when it comes to meeting people where they are? For community dwelling of individuals, what would you need in order for healthcare professionals to meet you where you are?
So, in order for the people in the community to meet us where we are as healthcare professionals?
And vice versa.
Okay.
Address from both perspectives.
Yeah, I mean, I think that a lot of it is, finding common ground, understanding stories and individual circumstances for sure, but also just, working together to improve access to certain resources as well. We talk about nutrition, we talk about exercise and so forth, and just making sure that these are the type of things, if you're gonna say that, okay, well, if you wanna lose weight, then you need to do this and that, well, you can't just leave it there, right? It has to also come along with some kind of qualification or some kind of guidance or direction, or a commitment to provide access to some sort of a resource that's attainable for the person that you're actually speaking with. So I think about things in the program, in the community, like for example, the Silver Sneakers program that's available under Medicare Advantage plans. They also talk about access to nutrition, which you probably attest to the fact that sometimes access to nutrition is not very available. It's not very available a lot of times. So just kind of working together to find creative ways to improve access and acknowledging that that's a kind of a part of the deal when you're talking to somebody and having a frank discussion about, okay, well, this is really affecting your life and having an impact on these chronic conditions. Not just saying, okay, well, you need to lose weight, but also having that second step in terms of how to get there with them.
And understanding where their mind is, how they, how their thought processes are as well, because that's important, because it is a mindset that has to take place in order to be able to stick with it, whatever the case is, whatever it is, whatever you recommend, having an understanding of that. Now, when it comes to self-advocacy, we believe that contributes to a healthy lifestyle. So when it comes to communicating about health issues and challenges, what do you feel are some of the strategies that can be implemented in order to engage patients in discussion and encourage self-advocacy? Because again, it's a mindset. So how do we get them to understand that they have to advocate for themselves as well?
It's very difficult, for sure. You have more experience with that than I would as somebody who has an office practice. This would be a good time for me to introduce the folks with our 4C program, Clayton County Community Cares. If you gentlemen and ladies wouldn't mind standing up.
Kim is entourage, y'all.
So I traveled with a team. Thank you. So this is my team, or part of my team. So between the four of us here, we have somebody who could see you in the office and take care of you. We have somebody who can whip you into shape. someone who can help you get there by eating nutritionally, and we have an emergency physician who can take care of you when you're really sick, along with this group. But this group is special in that we're focusing on patients who have trouble getting to care, who are the neediest of the needy. Folks who are sitting in this audience we see folks who are able to get to community centers. We see a ton of folks who unfortunately can't get to their physician, can't get to somebody to help work out, can't see a dietitian. So we see patients who are really needy and really suffer from lack of health care insurance, lack of transportation, lack of food, lack of medications, and lack of access to health care. We live in a community that has one physician for almost every 4,000 patients. That's not very good. So seeing a physician is really tough. I don't know if you've all tried to make an appointment with your doctor, been told it'll be 3 or 4 weeks from now. So what's your response when you're really sick? What do you do when you're really ill? You call 911, you call these guys. So we see you, we have you go to an emergency room, but then on the back end, these guys and ladies come out and see you at the home and see what you really need, because we want to keep you healthy, and that's where this program comes in. So getting out to the community and seeing patients.
Awesome, that's great. And I was actually going to ask about that, about how we can improve transportation options for older adults who are suffering with obesity, especially those living in rural areas. So I feel like some of what you said addressed that. But is there any other mechanisms or transportation options that you guys can suggest? Or?
Yeah, well, if I may, I would like to just put a plug in for GenCare Senior Medical Center at all as well. Is everybody here familiar with GenCare, or have you heard, show of hands, have you heard of GenCare before? Okay, good amount of people, and then some people maybe not. But yeah, we're a senior medical center. We have 6 clinics within the Atlanta metropolitan area. One of them is located on Mount Zion Road, right across the street from South Lake Mall. And what we do is that, we're primary care. We focus on seniors, but in addition to try to provide high quality medical care, we also try to break down some of these barriers when it comes to access to care. So one thing we do is we do offer transportation. We actually work with Uber and Lyft to transport folks. We also work with other local transportation companies for people that have other needs in regards to wheelchair and stretchers and so forth. In addition to that, we also have a patient advocate at every single clinic. So when you talk about this question of advocacy and the patients advocating for themselves, well, on the level of the actual patient himself or the person himself, it's difficult to really advocate for yourself, right? You don't know exactly where to start or how to even go about doing something like that, right? So what we do is that we have patient advocates within our clinics that don't just advocate in a broad sense on behalf of the community, but they meet patients and they talk to them, they get to know them, and they advocate for them on a personal level, because everybody has their own personal circumstances, they all have their own personal needs, different needs that need to be advocated on for them. So they actually tailor the actual advocacy to the actual patient that they're dealing with at that time. So that's been very helpful in terms of our connection to the community. And in addition to that, we also have different programs, different social events so we can be a place that is not just a clinic to go to for medical care, but somewhere that you can go to, feel comfortable, be able to fellowship with other folks in the community as well, and just be a safe space for the community.
Thank you so much for that, Doctor, because when it comes to programming and community outreach, that was going to be another question as well. I was going to ask, what role can senior centers play to engage older adults in activities that will enhance their well-being? And you spoke to that a bit. Is there anyone else who could speak to that?
I think that sometimes we need cooking classes and just to show that it's there's some easy recipes that you can do to cook that are healthy, and also just have dietitians coming in to speak about what's healthy and what's not, because sometimes like we are available like online sometimes, telehealth, and some make home visits also, but it is hard, like if you have insurance and you want to use your insurance, it is hard to find a dietitian that actually accepts insurance as well. And so sometimes the out of pocket can be a little more expensive as well. So, but just having little classes to do educations as a group, that will help, that's easier, because there are a lot of dietitians that will do it for free and they will not charge anything to do education tips for them. And also I have students, I teach dietetic interns, and so we use them as resources as well to come and help educate more. It kind of helps to spread us into the community more than just us, one person. So
That's awesome. Well, thank you for your service in that department. Absolutely. Now, I do want to ask this because, again, sometimes this can go over a lot of people's heads in terms of even how to talk about their health and the language and the communication factors. What are some ways that you guys are helping to make sure that they have a basic level of health literacy when it comes to understanding even what it is they're talking about? Because approximately 36% of U.S. adult Americans have what they call a basic level of health literacy, being able to just read an appointment slip or brochure. That might be the extent of it. Now, health literacy plays a major role in self-advocacy, as we're speaking about. So how can health professionals incorporate health literacy and healthy lifestyle in these communities, particularly those of color, which tend to get overlooked or disregarded?
Yeah, I think a lot of it has to do with the fact that, number one, recognizing, the level of health literacy that people might have, right? So a lot of that also comes from actually asking certain questions, like for example, you see a patient, you use the word congestive heart failure. I've met patients before who have been going to our center for several years, meet them for the first time, and I see in the chart congestive heart failure as a diagnosis. And I ask them, number one, did you know you had congestive heart failure? And number two, do you know what it is? Define it for me. So getting what their understanding is. And you'll be surprised. Sometimes we make certain assumptions one way or the other in terms of what level of literacy somebody might have. But I think the first step is actually just getting an idea of exactly where they are with that and kind of adjusting your messaging and your conversation to that level. So a lot of it, on our end is just, making sure you're not using too many large medical terms and medical jargon, and making sure that you're creating a safe space so that they can feel comfortable to ask questions as well. So that's kind of where it really starts. It's kind of breaking down those barriers and creating a level of comfort.
Awesome, awesome. And to piggyback on that, when it comes to providers overcoming language barriers, because even me, myself, I'm Haitian, so my parents, English is their second language, right? So there's beyond understanding even those American terms, there's other words they just can't fathom. So how are you able to communicate to those who might have a language barrier? What are some ways to overcome that?
Being privileged to work in a fairly new building, we have a training kitchen that you were speaking of, and being able to have the demos and the demonstrations and teaching about nutrition and things of that nature. So when we get to translating that into the terms where our seniors or our adults at my center can really gravitate and get it and keep it, is relationships and being consistent with the programs that we're putting forth, with our relationships with Southern Region, Gym Care, Humana. We allow partnerships and allow them to bring specialties and people in that do specializes and things of that nature. So when he was saying heart failure or carotid heart, they be looking like, what is that? That all has to do with heart disease. So taking that, giving it, throwing it at them, and then breaking it down from the heart disease, how the heart pumps, what makes the heart pumps, how much blood is pumped into the heart, with You just sitting there right now doing nothing. Your heart is pumping 8 liters of blood without your effort. So it's just getting that relationship and really clarifying that with them. If you was working out, your heart would pump up to 18 to 21 liters of blood. That's a lot of blood. So being able to have those communications and those conversations and in a setting and having the opportunity to have a building that can bring those conversations and bring that awareness and clarify a lot of the doctor stuff. Because right now we just go and they got 30 minutes with you. They can barely give you any kind of information and they tell you, go work out where you need that direction. So at our senior centers, we're able to really gear them to a healthy lifestyle, proper eating, and then discipline in what they need to do for is their health and fitness journey. And if they have a disease that is in an acute stage, acute means it's not that serious. You can come back from that, but they need to know when to get to a chronic stage. That's uncurable. So being able to explain it, break it down, and make it more clear, but still giving them the doctor stuff, and that's beneficial, and making sure that they are going back and forth with their doctors and listening to what the doctor's saying, but us having the information at our fingertips to be able to give it to them when they need it and help to clarify it a lot more when you only got 20 minutes with the doctor.
Thank you so much. Anybody want to piggyback?
I just wanted to add something, like at Southern Regional, we do have language services as well. So we do call, have a language line for the patients, so when we educate, because education is even hard for people that speak our language. So we do have the phone service, and then for outpatient dietitian, I usually will do like a pre-assessment for them to see what language they do actually speak, so I can figure out the education material that I need to provide for them prior to having them, and then also trying to get somebody to help me interpret if they need to.
Thank you for that. And I probably want to ask another question that you might be best to answer, at least in the beginning. Studies show high levels of cortisol contribute to weight gain. Now, of course, this is exacerbated in Black women in comparison to their white counterparts and affects overall health. What are some ways or strategies that can address this issue?
I think a lot of times, like the types of foods that we're eating, it can interfere with our hormone levels. And so being aware of the types of foods that can create that issue is very important, because even though you might think that it's a healthy food because the package says it's healthy, it may or may not be healthy for you, and especially like, dairy products and things like that, they do give the animals, hormones and things. So being aware of the foods that you're eating, we would have to do a full assessment as far as like what you're consuming, and figuring out those things and doing an elimination diet to kind of see and helping figure out what foods are causing this higher level of cortisol.
Okay, awesome. Anybody else have anything to add to that?
I would also just add that cortisone is what we call a stress-induced hormone. So in a lot of these communities, guess what we're dealing with a lot more of than other folks? Stress,
Yes.
right? So I think just addressing those kind of social determinants of health that contribute to a person's health medical conditions, and kind of meeting them where they are, as we talked about earlier, in terms of what can we do in terms of their environment, their surroundings, and their everyday living. How can we help them in that regard, and to reduce stress, helping to manage stress, helping to maintain mental health, and then once you address those things, and that can trickle down to the medical, to the levels of hormones and so forth. Another thing I would say too is that in the primary care setting, cortisol levels are things that we don't really routinely check in the primary care setting. So we can also take a look at that and see if there's been different ways that we can maybe address that, and tailor our screenings towards certain populations that we know might be more affected by certain conditions. I do know, sometimes we might send somebody for a CAT scan for a certain medical condition, as you might be able to attest to. And sometimes we incidentally find spots on their adrenal glands, which are the glands that are responsible for producing cortisol. And a lot of times we just see them and say, oh, they look benign, and we might not do much additional evaluation. But in certain populations, these things might be more likely to secrete higher levels of cortisol. So maybe adjusting our management and our guidelines in terms of how to approach situations like that potentially could be beneficial for certain populations that we speak of.
Absolutely, absolutely. And when it comes to stress management, for me, I know what works is a lot of exercise. So, Anton, what are some ways that fitness regimens and exercising can help with stress relief?
When you're stressed, you don't want to do nothing. So, because your body produces the hormones that he was speaking of, it can gear you in any direction. When you work out, you trigger different hormones, dopamine and things of that nature, that gives you energy, gives you that drive, that want to work out. And a lot of it has to do with really getting in line with you being stressed, what you need to do to take care of that. Because if you have finance issues, can't pay bills, can't pay your medical bills, you ain't worried about working out. You're trying to live every day. If you're treating me to a burger, and that's what I have to go with, then I'm not worrying about no diet. So first getting that in order, like I do massage therapy, how beneficial that is. But if it's not in your tax bracket, then you're not accustomed with it, you lose conscious of it. That it really helps to filter your blood and to help move your systems in your body so you can clean out your lymph nodes and your lymphatic systems and your hormone systems and your endocrine systems. I can go through all the different systems. But exercise is the best vitamin. It is the only fountain of youth. It's the only fountain. Everything else is a temporary fix. So it's just developing day by day, more and more, trying to get to a place of a goal or being persistent. And then you'll be able to see results, to better yourself, and being more and more encouraged. But it takes you showing up, and showing up is you seize the moment, then you have to maximize it. So since you're already here, and I got you in this class, let's do this. And then you'll be like, wow, I did more than I thought I could. You leave the class, stress is gone. What you thought about, what you was dealing with, because it's a vitamin that what they have on the market can't fix. If you're looking for the fountain of youth, it's what you put into yourself. It's only what you put into yourself. So engaging little by little, it don't have to be all or nothing. Take little steps, little goals, and little stuff like that will help with the stress. It ain't gonna be no overnight fix, but what you put into yourself is what you're gonna get out of yourself. I can't carry you. When I'm working with my members, if there's a fire in this building, I can't carry you out of here. You gotta carry your own self out of here. So we hold in that squat for 3 minutes. Hold it, they be hollering. Miss Alice had to hold it today. Because I want you to be strength enough to carry yourself. And when you start having those challenges that you're meeting, stress is coming off a little bit. And then you're in a social environment. You're dealing with people, you're having relationships. And now you're partnering up or you're with people who y'all all influence one another. So now I want to go. I want to go because I know Miss Alice is going to be there. I know Tori going to be there. And it's now we're a relation, a family, a community of love. So just coming around the community like senior service, and the members is giving that love, and we're teaching one another to just help support one another. All that matters. All that matters. But exercise is the best way to decrease stress, and it takes just discipline and just a little bit at a time. It don't have to be all or nothing.
Thank you so much. Thank you so much. And to piggyback on what you said about the community and how we influence each other when we're in the same space. Now, social isolation can be an issue when it comes to older adults, especially those who have obesity. What are some things that we can do to help them seek and adhere to obesity treatment if they're in a place where they're isolated or they're by themselves?
That's very tough. You gotta get out and see the folks in their home environment. That's one of the programs that we're working on, in actually getting out to the home environment and introducing some of these things that you're talking about, the diet and the exercise, or changing it into a more healthier lifestyle. But many times it's very complicated. There's no one quick fix, but seeing patients in their home environment is very important.
Absolutely, thank you for that. And just one question I'm going to ask for the entire group. When it comes to your experience, when it comes to working with people or seeing people with obesity, how does it affect you personally when it comes to dealing with that or seeing that, or is it something that you've experienced within your own families or anything like that? What is your personal take or perspective when it comes to obesity? I'll start with you, Martin.
Yeah, I mean, I think on a personal level, everybody can probably attest to the fact that they probably have people in their family or who might be able to identify in that category. So it affects all of us and it touches all of us, you know. And from a personal perspective, as a primary care physician, you know, when I work with seniors, you know, I always look at them as my parents, right? So I always think about, okay, if my mother or my father were to go to a medical clinic and receive medical care, how would I want a physician to interact with them? Or how would I want them to be treated if they were to go to an establishment? You know, and try to basically hold myself to that same standard on a daily basis. So, you know, that personal touch or that, you know, being able to identify with them and seeing them as family, not just another person or just a patient, I think that really contributes a lot to the way I interact and approach everything in regards to interactions.
Thank you so much for that. Anton?
Tenderness, being sincere, and being open and honest. Transparent if you have to at times. Some people do need a tough conversation. Some people do need a push. But tenderness, because you got to get them in. You got to make them want to be involved, make them want to be present in the moment, and then educate. But you got to be tender with it because it didn't follow them a whole lot it didn't follow them all their lives at times. Especially if you grew up obesity and you aged with it, it followed them. So they got to start with tenderness and then educating them and then just setting up goals, helping them, even if it have to be a partnership with a lot of my members who I know that don't come to class and they try to avoid that because of obesity. I give them homework. I give them homework that they have to focus and do at home, and then they have to bring it back to me, and it's a constant thing. So it's almost like, what do you call that?
Accountability.
Accountability part, correct. And I see that. There's certain ones that's in my center that do not want to be around other people, or just, so it's going to take tenderness. And then it takes those little challenges and those little things, wow, you care. And when they come back, they were like, I did everything, I did that list. And they will tell you how much now they're more postured or they're more stronger. So it takes just being aware and addressing it and following back up with it.
Mira, how does it affect you personally?
Yeah, in my family, definitely. I'm from West Virginia, so it's like one of the most obese states. And so my family has obesity as well. And so I do help them with little goals that we do. When they come to my house, I help them like try different foods. And then just personally for me as well, just being compassionate with my patients and meeting them halfway wherever they are. That in general just helps the client just want to push more to do better. But yeah, nutrition is like something that is very important because especially the food, the access that we have of food and fast food as well. We are very busy people a lot of times, and we're just grab and go, anything that's quick and easy, or someone's circumstances may not allow them to have certain, foods that are necessarily healthy. And so that's why, we just look for help with, convenience of eating healthy, but convenience at the same time. And so just looking into like what they're currently eating, talking to them about what they're eating, and listening to that as well, so we can come up with a conclusion to say, hey, let's start here, instead of some people feeling like they have to go all the way to this point. And that's how you go backwards. So we just start with something very small and then increase from there.
Thank you so much.
Yeah. I piggyback on that. When you have the opportunity to talk to patients, just figure out where they're coming from. Start small. Let's get you a primary care physician. Let's talk about eating in a healthier manner. Avoid things like, let's put you on a diet. A diet doesn't mean stop eating. A diet means eat differently. Exercise means not running circles. It means walking initially, take baby steps, and then work from there. So have that, when you have the opportunity, when you have a patient in front of you, don't be hesitant to talk to them about what the problem is.
Absolutely. Thank you all for that. Now we're going to take a moment to take some questions from the audience, because I know we had a lot of great insight, a lot of good information. So we just want to get your thoughts and your perspective as well, because we want you to be a part of this conversation. So I believe we have Jamie, who's going to be in the audience for us. Yes. I'm not sure if this is a working mic. But if you don't mind, if anyone has a question for one of our yes, there we have one.
Last holiday season, I went to Oak Street, and they had a demonstration about how to eat healthy food during the holidays, like replacing the macaroni and cheese with cauliflower, etc. But I've only been to one of those classes, so I'm wondering why there aren't those classes more often, like weekly or at least monthly, and with more participation. I learned a lot, but I just think there needs to be more emphasis on it more often. Something regular.
We would agree with you.
Yeah, I agree. I mean, that's something that should be more often, and I think more outreach as far as finding providers that can help come out more often, that can help out the patients and the clients.
And if I may put a plug for GenCare as well, we do have a diabetic education class right now that we are piloting at our center. So basically, it is going to be a longitudinal thing, weekly meeting with a nutritionist, and it's also ran by one of our primary care physicians as well, where we're giving tips on healthy eating, exercise, lifestyle, managing medications, and so forth. So it is true that in a general sense, these things are probably not happening often enough in clinics, but it's something that we're paying attention to because the people have spoken and they've basically shared the same concerns that you have, and then we're hearing them. So that's something that we're working on in our center as well.
Awesome, thank you. Tori, I believe you wanted to address that question?
Yes, because I felt the heat
Okay.
looking over here at me. This is something that we tap dance a lot with. as you guys know, we love you guys dearly, and we always are trying to do the things that you want to do with slipping in the things that you don't really want to do. So we have offered classes like that, and we will start to offer more. But I will tell you this, we have a healthy item on our menu every day that doesn't do well. And when we change the menu too much, we get a lot of flack. Trust me, I know, because we've done it. But this setting, what we're trying to do is show you that we're really serious about changing what we do, because we want you to live a longer, healthier life, right? So we will do better. And so we teeter-totter between going all in, and then we get a little pushback. And then we have people like you who just spoke up and said, we want more, we want more. So we do the more, and then, so for us, I will admit, we have to probably get a little bit more consistent and just continue to do the things that we know are right. But just know that when you complain, I get those complaints, and we have a good old chairman that's sitting right in here who has heard the complaints. What are they doing? Why are they changing the menu? We don't want that. So we have to work together. We understand, we respect you. You are adults. You are smarter than us. You have worked your entire life. You know what you want to do, and you know what you don't want to do. However, at the same time, we have a personal responsibility as staff to try to help you just live your best life. We don't want you at home and can't get out and can't drive and go and live what you do. We have a whole unit here that can tell you the stories of what they're seeing. We do not want them to ever have to come and visit you. So when we change the menu and we offer these classes and we do stuff like this, we want you to be driving at 110 if you want to be driving. We want you to be in Anton's class. We want you to be in the classes here at Frank Bailey. So just work with us. And we have to do better. We're not trying to tell you what to do. We just want to keep you here smiling and healthy and doing things that you want to do. But I'm getting off my soapbox because I know I went too long.
Any other questions?
And to piggyback off of that, pretty much we all have open doors. So just let me talk to you real quick, or I want to see more of this and more of that, or put something in the suggestion box, because we never shy away to a request. It's just, everything is planned at certain times. Like right now, we're planning for the next 6 months, and all that has to be approved and go forth. So you saying that, the planners, they hear it, they start putting it in their planning. So just grab us every now and then and whisper in our ear or make a request, because all we do here is create programs that we think you will like and will bring you in. That's all we want to do. We want to treat you, we want to bring you into the program and make you more social, make you more fit. So just grab one of us, have a conversation, and then we'll use whatever partners we have, or we'll do it. You'll see us do it a lot ourselves. So if that's what you need, grab one of us, and then let's get it working.
So awesome. Do you have any other questions from the audience?
This is really not a question, it's more of to this panel here. Could you elaborate a little bit more on how important it is for older adults to make sure that their muscles are strong, as in keep, doing the resistant work? That's very important. Could you elaborate a little bit more?
What goes up must come. Every day gravity's fighting against you, and it's pushing you down. Like we talked about the disease of obesity, you have a disease of kyphosis, which is the humpback of Notre Dame. So when you see somebody hunchbacked over, that's a disease. And the only way, whatever age you are, as you age, your bones will degenerate. Your arthritis will start coming in, and degeneration of arthritis and things of that nature. Being persistent, honestly, and really setting goals. It's not a one hit a month. It has to be a lifestyle. Because, like I said, your body degenerates with age especially. And the more that it degenerates, it gets more to different stages of the disease where it can be uncurable at times. For your muscles to stay healthy, you gotta stay moving. Your heart is a muscle. Only thing it's asking you to do is get my heart rate up. If you get me up, it strengthens me. And if it strengthens me, I can pump your blood longer. And I can clean your blood. And as long as the heart is more strengthened and the valves aren't clogged up, your capillaries and your vessels and all those veins and stuff, you now have that capacity. Then when you start working out, you have that muscle memory. You have to tone. You have to have a lifestyle of stretching. Because you can work out all you want, but if you're not limber, if you're not flexible, you can just reach down and grab a piece of paper and your back go out because your muscles are cold and they pop. They're too tight. You gotta loosen. You should be like elasticity. Your body can reach and stretch. So a lifestyle of stretching, being flexible, limber, and then really engage. It don't have to be a lot. You don't have to lift 150 pounds. Do 20, in our class we do about 50 to 100 bicep curls. Just keeping those muscles engaged because that moves blood and oxygen into those muscles and keep them more healthy, they're more alive, and keep them more density where you can take a fall and recover. Because that's your muscles having the ability to be able to take a hit and still recover. We had somebody who's 75 and she just was in a car accident. And it probably took her 3 weeks to recover. It normally takes you 8 weeks. But it depends on your lifestyle, your discipline. So to keep your muscles strong, you have to have a set goal, a focus of a workout regimen, and you have to be persistent with it. That's the bottom line. You have to be persistent. You have to put into it because your muscles will degenerate, your bones will degenerate, and as they degenerate, it lacks in different areas. So if you're alkaline and at a certain level, it's going to pull from your marrow, your bones. So now your bones is going to start degenerating. So it's a discipline with stretching, toning, and just staying active.
Thank you. We can take one more.
Yeah, I wanted to say there's an exercise called dynamic tension where you do muscle against muscle, and you don't have to go to the gym. You just push muscle against muscle. You flex your muscles each direction. You know, like push against your neck, and that's building it up. The other way also. You know, like muscle against muscle, dynamic tension. I don't know if anybody's heard of that before.
Anyone else?
Hi, my name is Amanda. I'm dietetic intern under Lamera, and I just want to add a comment to the lady who had a question before. With elder adults, we do have conditions that is called sarcopenia, obesity. That means that while you have a low muscle mass, you also have the condition of obesity at the same time. And it is reversible with diet and exercise, especially with resistance training that really stresses your body a little bit and helping your body to build a stronger muscle mass is really important to retain your muscle mass while aging, because this condition is age-related. So just focus on diet, having enough protein intake, daily, get the eggs, get the scrambled eggs, get the chicken breast, get the meat in, get the milk in, and also do the resistance exercise. The dynamic muscle training sounds good to me. Also, stretching is very important because that's also some exercise that you can start with when you are like zero level with fitness. So you can start with little by little by just stretching, doing stretching exercise. And when you feel you're ready, you can do more starting putting like heavy loads on yourself and doing resistance training. And that will help with sarcopenia, obesity. So thank you.
Awesome. Thank you so much. Thank you everyone as part of the panel today for all your information. Actually, we have the commissioner who has.
Hi, I'm Devon Davis. I'm the Clayton County Commissioner in District 4. And this is something that's very near and dear for me as well. And just to let you know, on April 15th at the Lake Spivey Recreation Center, we're having what's called a Get Fit Expo. And what we do at that Get Fit Expo is we have nutritionists, we have exercise folks, we have medical, we have dental, we also have financial folks there to help you all begin to get screened, to begin to learn about exercise, and I believe Senior Services is going to be there as well. Tori, is that correct?
Sure, yes.
See how you all do? You just put it on. But that's going to be from 10 to 3, September the 15th at Lake Spivey Recreation Center. I'm sorry. I just say this. Ooh, that's going to be the next one. April 15th is going to be the one coming.
Griswold is going to be there.
Lake Spivey Recreation Center. 10 to 3. And we have about 45 vendors as of this moment. We just gave one Gen Care. We just gave one to Gen Care, so hopefully they will be there. The booths are free. But we are really trying to get you all out. We want to get exposed. All this information that you're talking about, all the information that someone over here said about cooking healthy and healthy eating and healthy dieting, but also the exercise. So hopefully we'll see you out there.
Thank you so much, Commissioner. While you're there, Jamie, I just want to take the moment to have Commissioner Turner, Chairman Turner, to say a few words to greet everyone.
All right. Good afternoon, everyone. Good afternoon. Listen, Tori said something earlier about driving 110 miles an hour. We don't do that. All right? I just want to make sure I clarify that we don't do 110 miles anywhere. All right. But listen, let's give Ms. Strawder Tanks a round of applause, her and her staff, for making this happen. We in this county take your mental health and physical wellness very serious. As Tori said, you're the ones who helped lay the foundation for helping make us a great county. We have the liveliest seniors anywhere. We want you to stay that way, but in order to stay that way, you gotta what? You gotta eat right, you gotta exercise, and you gotta do right every day. It's not just something that you do for a season or a short period of time. You have to do this every day. Consistency. Consistency. Now, I'm glad that the young lady right there said what you can eat, because I'm eating a lot of that along with some other stuff. And it's going to be hard to try to break some of those eating habits. But we have to change the way we do what we do. And that's our eating habits. Make sure we exercise at least, what is it? Somebody correct me, about 30 minutes a day at least, minimum. Or for cardio, at least 30 minutes. We have beautiful trail system in this county. We have great senior centers that's built with you in mind for you. Utilize it. Utilize our trail system. And if you want something else, come talk to us about that and we'll see what we can do to make sure that happens. Because again, we are here to serve you, to make sure that you have longevity in your life. You've worked all your life, now it's time to have fun and to play. And a lot of y'all definitely play. Because I see you. But I know I don't want to prolong the hour, but I appreciate the opportunity to say a few words, talk about this great program, this opportunity. Thank y'all for registering to be part of the study, and I'm looking forward to what's going to come out of it. So God bless and enjoy the rest of your afternoon.
Thank you so much, Chairman. Thank you. Now, speaking of what's going to come out of it, this is the part of the program where we break out into sessions. Now, the idea behind breaking out into sessions is to be able to get more of your point of view and your perspective on a more granular level, so that we can be able to ask the questions directly to you, get some of your responses, and use that feedback in a survey that we're going to also have you fill out immediately following the breakout sessions. So what we're going to do is you receive a ticket upon registering, and they are color-coded. So based on the color that you have is going to be the group that you are in. And we do have 4 of our leaders for the breakout sessions that are going to be around the room. We're going to be having one in this area, so I'm going to say the blue is going to be in this corner, and that is Miss Elaine Jackson. Elaine, where are you? Okay, Elaine, she'll be over here in the blue section. Then we're going to have Joy, who's going to be red. She'll be back there in that section. Right, so anybody with a red ticket. Christy's going to be over here for the white section. She has, so we have a white ticket. And then we have Courtney Johnson, who's going to be back there with the orange. So if you have an orange ticket, you're going to be back there. We're going to take about 20 minutes to do the breakout session. So based on the color that you have, you can make your way over to those areas. So we're going to play musical chairs real quick. All right, now that we have gotten through the breakout sessions, we just want to hear a little bit more from you all. So we're going to ask that our team leads, where are they? Our team leads, Elaine, Christy, Courtney, and Joy. Awesome, awesome. So we're going to ask for you to kind of help us facilitate this piece. So if you can either come up and just let us know what your teams are saying, or even if you want to give them the opportunity to speak, but we'd love to hear some of the feedback that you were able to receive from your groups. So we'll start with the white team, Ms. Christy.
Hello again, Frank Bailey. Okay, so this was one of the questions that I asked my group, and it was how can we improve access to healthy food options and physical activity for people who live in food deserts or have limited mobility. So these were a few things that we came up with in my group. So one of the suggestions was that we could partner with stores like Whole Foods, Sprouts, Trader Joe's, even Kroger, to help donate healthy food options. And another suggestion was that, you know how we have the ice cream trucks that used to come around? Have those healthy foods in a truck like that, something similar to that, and take it to the neighborhoods. Bring the food to where the people are, so that way those who have limited mobility or limited access to healthy foods or fresh fruits and vegetables, they'll have access via it being brought to them, and all they have to do is go out and pick it and take it back inside. Another question that we talked about was mental health and how it plays a critical role in our overall health and well-being, and what strategies can be implemented to increase access to mental health resources. So one of the things that my group that we talked about was that sharing stories. So with the mental health providers, because we do know that there can be a disparity. We said that letting somebody know that you have the same thing, closing that gap with what somebody else has versus what you have, it just breaks that stigma. Like they're not the only one suffering with a particular mental health issue. Thank you. And another thing that they brought was doing in the community, even like here, doing more like outdoor activities to help with mental health issues, just getting out in the sun. And then let's see, what else do we have here? We also had someone suggest about doing that staff during COVID time, staff members used to call the members here when they when they weren't here during COVID and would check on them. And one of the people at my table said how they really appreciated that they really appreciated getting those phone calls. And that also helps with the mental illness issue. So you're not just a shut-in on your own. You know somebody cares about you. And that's the basis of our topics that we talk about at my table.
Thank you so much, white team. Thank you, thank you. All right, up next is red team, Miss Joy Walston. Come on down.
So, hello. And the first one that we worked on was how can we improve access to healthy food options and physical activity for people who live in food deserts as well, that have limited mobility. Well, my table, they suggested more Meals on Wheels, which we have that, but more of that. Also, transportation, outreach programs, and provide internet. That was for the first one, and provide internet access for all people. Johnny mentioned Senior Fit on Uverse. I don't know if anybody knows anything about that. I hadn't heard about that, but it's Senior Fit that's provided on Uverse. Okay, and then the second one that we did was what role do mental health and social support play in maintaining a healthy lifestyle, and how can we address the disparities in mental health care and social support in marginalized communities? Need more people in the trained in this situation to help people with mental illness. Train more people. That's something that we see here a lot. People come in and it's obvious that some, and not only here, but other places that they have, and they're suffering from different mental illnesses, but don't have access to any help. And you can't make them get help. So I see that a lot where, someone might come out and that they're suffering with something mentally, but you cannot make them go to the hospital or take them away. So people more trained in that aspect. What are some strategies? What are some strategies? I can't say the word. Okay. What are some strategies for improving health literacy in communities with low level of education, language barriers, or other challenges? Sometimes we need to go and meet them. Well, I'm reading the wrong one, I'm sorry. Okay, let me read this one. How can we encourage policymakers to address healthcare disparities that are disproportionately affects communities of color? What policies and strategies could be implemented to improve health outcomes in these communities? And we came up with sometimes we need to go and meet our policymakers where they are and just go to them with the different issues and the problems, and go to the board meetings and different places, meet them where they are, and tell them what the issues are. And also getting out to the voting booths and vote. So we need to do that, be out there and go and vote on these different issues. Thank you. That's what that's really it.
Thank you, Red Team. Awesome, awesome. So now we have the Orange Team. Give it up for the Orange Team, Miss Courtney. Hey!
All right, so good afternoon, everyone. So we did very similar. We were a small group, but I felt like we had a really good discussion. We were able to complete 4 questions, so I'll go through. The first one was similar to everyone else. How can we improve access to healthy food options and physical activity for people who live in food deserts or have limited mobility? So the group did suggest a delivered food option. Not like Meals on Wheels where food is already cooked, but it's healthy, like fresh foods, fresh vegetables. That way people can cook it for themselves at home. They can season it how they like. They can also utilize the fresh vegetables and fruits in their cooking. So that led to something else. So I'm going to bring it up while we're here. We also kind of discussed in the senior centers how we have the lunch lines. So it came up that the staff should be more respectful to the seniors. Okay, I'm just a messenger. Okay, so I'm picking the Piccadilly staff being more respectful to our seniors when they are working the line. So I promise I will get that message out. Okay. The second question was, what role do mental health and social support play in maintaining a healthy lifestyle? And how can we address the disparities in mental health care and social support in marginalized communities? Sorry, I gotta go back and forth. And so they just stated the importance of checking on one another. Just while we're here at the center, when you come to the center, you know, you're socializing, you're checking on each other to see how we are doing mentally and far as being an accountability partner. But then also, don't forget those who are at home, who are homebound, you know, checking on them, just seeing how they're doing. Also, it was brought up as far as resources that we can provide to those who may be needed. And also, Frank Bailey actually came up and they said for them, Frank Bailey is a resource for them, because as you talk to other people, they're sharing resources amongst each other. Our third question is, how can we encourage policymakers to address healthcare disparities that disproportionately affects communities of color? What policies or strategies can be implemented to improve health outcomes in these communities? Vote them out. If you don't like your policy, your politicians, utilize your right to vote. So voting them out. Expanding on services currently offered. They want politicians as well as healthcare providers to stop using scare tactics. So we need to understand our rights, vote them out. They would like for politicians and doctors to give information that they can digest, not giving too much information at one time, so allowing them to expand upon the information that's given, to think it out, and to ask questions. All right, our last question. In some communities, there is a lack of trust in the healthcare system and medical professionals. What can be done to build trust and improve communication between healthcare providers and patients in these communities? Should have an assistant. So, the Orange Group, don't want them to, healthcare providers to insult their intelligence, okay? Sometimes it came an example, like maybe you know how salespeople go to doctors and they're trying to sell something, but then the doctor is trying to give it to the patient. So that was just an example. So they say sometimes physicians don't understand other factors that could be impacting the health that we're going through. So there needs to be a relationship between the doctor and the patient. So not only the doctor asking the patient how they're doing, but the patient also asking the doctor how they're doing, telling them about, factors that's going on in their life that's impacting health. And also dementia. Sometimes physicians don't have the knowledge that understand dementia and the treatment for it. So a lot of caregivers, they advocate for their loved ones and they rely heavily on their PCP. So the PCP needs to be able to recognize when they need to refer the patient timely. And just being an advocate for yourself, making sure you're going in, you're asking questions, getting the answers, and if you don't like the answers that you receive, change doctors. Okay? Thank you.
Thank you, Orange. Yes, now last but definitely not least, the little group, Miss Elaine Jackson. Come on down. Hey.
Thank you. We had a fantastic group.
I can tell.
So what we did, we only got to 2 questions, so we had a good discussion. But the first one that we talked about was older adults may face unique challenges when it comes to accessing health care and resources. And what are some strategies that can be used to better support the health and well-being of older adults in the communities? And we kind of broke it down into 2 different sections. And one was eating healthy, nutrition, and the other one was going to the doctor. And some of the things that were said for the nutrition part of it is to eat healthy, of course, exercise. And so the question was raised, well, suppose you are not, privy to be able to buy healthy, fresh vegetables and fruits and different things like that. So it was suggested that take advantage of some of the giveaways that lately, especially since COVID, we've had a lot of different organizations who are giving fresh vegetables and fresh fruits. So just take advantage of that. Go to some of those places, just kind of check out and see when they are offering these giveaways. And so that's one way to get your fresh vegetables and your fruits. And another one is to really be cautious of how you are eating. One thing that came out of the group was that canned vegetables are not good for you because they're loaded with sodium. So, eat frozen vegetables are better than eating out of a can. So, just kind of take advantage of that. And another thing that we kind of broke it down and we talked about was health care, going to the doctor. And one thing that was really interesting that came out of the discussion was one of the participants in our group was saying that when she goes to the doctor and she has someone with her, like a lot of times seniors will have maybe a child to go with them, a son, a daughter, or somebody just to go with them. But that the doctor will usually address that person and not the patient. And so she was saying that the communication is really not there because they don't address her because she's the one with the issues, but they're asking her son or her daughter, what's going on or what's wrong. And that is very belittling to them. So that is something that they just wanted to say and wanted to get out is that when you talk to your healthcare professional, just make sure that they understand that I'm the patient. I'm the one, with the issues. I'm the one with the problems, not my daughter, not my son, or whoever, is with you. And someone else in the group felt like the doctor should be more of an educator and a resource person to give you information as to what you should be doing to live a healthy lifestyle. And let's see. And a nice, really good statement that came out of it was that when going to your health professional is that to recognize that the patient, recognizing the patient helps to build a healthy relationship between you and your doctor. And some of the other participants said they love their doctor. They have no problems with them whatsoever. That they're able to talk to them. They can stay as long as they want to discuss all the issues. So mainly you just have to speak up. If it's something you don't like, speak up. Okay, for the sake of time. We also talked about mental health, and it was really interesting to hear that a lot of the participants felt that during COVID, that isolation was a very big problem for other members and things like that, and that during isolation, during COVID, and they were isolated from the socialization and fellowship that they had here, that a lot of people developed physical illnesses, different types of illnesses, because they were just there. And so one thing that we can do as members and as, knowing that someone is not here or has not come back, we can reach out to those people. Just give them a call and say, how you doing, what's going on, just to kind of let them know that you are thinking about them, even though they can't get back to the center. So I'm not going to keep going on rambling, but like I said, we had really good discussion, a lot of good things came out of it, and you guys are on the ball. Because you know what you're doing, and one thing that came out too was that most of the people who were at my table, they are not shy. So they know how to communicate and to talk and to express what they need and what they want. So thank you very much.
Thank you so much, Blue Team. That was amazing. Give it up for yourselves for such an awesome breakout session. Yes. All of that was very valuable feedback and information that I'm sure our team members and staff members are going to be sure to put into play, or at least bring to those who can make changes and make decisions in those spaces. So thank you so much for voicing your opinions and sharing your thoughts. Your voices are being heard, and we thank you for taking part in this organization and in this town hall meeting to allow for that to happen. So thank you so much. Thank you for showing up, and thank you for showing out. Yes, absolutely. So we're going to start wrapping up. You all should have that survey. We're going to ask at this moment, if you haven't already, please pull up that survey and complete it. It's going to really help to inform, again, some of the things that we're trying to put in place for you to help you. Those are very, very, very important for us to be able to have completed. So please do so. If you need some assistance, we have people around the room. Raise your hands that are willing to help you so that we can be able to get that information into the right hands. Now I'm going to bring to the stage Miss Jamie Carlington. She's the Aging Administrator with the Clayton County Senior Services, so that she can give you a call to action to increase funding to the Senior Hunger Prevention Act of 2023. Ms. Jamie?
Okay, good afternoon, everyone. Wasn't that some great information?
Yes.
So, since you think it was so great, let me tell you what I need for you to do. There's currently an act going through Congress. It's called the Senior Hunger Prevention Act of 2023, and it's being sponsored by 3 Democrats, Senators Bob Casey, Christian Gillibrand, and John Fetterman. And basically, what this act is going to do, everything that you all talked about in terms of what you want to do with foods and transportation, they're trying to get Congress to increase money for seniors for programs such as this. So what they want to do is like streamline the nutrition access for older adults with disabilities. They want to establish what's called an Elderly Simplified Application Program, ESAP. And for those of you that may get SNAP benefits, or you know someone, a senior that's getting SNAP benefits, it's going to extend the certification period to 36 months. So they'll have more time to qualify and get their certification. Also, what they're going to do is they're trying to waive the recertification interview requirement for seniors. So this would be quite beneficial for those who are getting that. Also, if you're not getting SNAP, how many of you may sometimes order your food from Kroger's or Publix or something like that? and they have it delivered to your house. Well, they're trying to make it where seniors can get that done for a reduced price. Okay, so your food to be delivered to you. Anyone that takes SNAP, things like that, they want them to reduce the price. And you say, oh, well, that might come back on me. Nope, they're going to send them money if they participate in this act. They're going to pay the providers to make this happen. So, I am a member of Meals on Wheels Association of America and also Meals on Wheels Association of Georgia, and I'm actually the board president for the Georgia chapter. So we're trying to get everyone nationwide to sign up. All I need for you is to go see Miss Carrie over there, right? And I'm not asking for your phone number, I'm not asking for your email address. I just need your name and the city that you live in, and we're going to compound all this, and we're going to send it to Washington, D.C. All right. We want this to work. So that's all I'm asking for you guys. Yes, ma'am. Oh, no, this is nationwide.
See, some of the things that they have now, the program, you have to live in certain zip codes in order to get it.
Okay, no, this is nationwide. That's why they reached out to me from our national chapter, okay? Any other questions? So please make sure before you leave today, you visit Carrie and you just sign your name. And as the information flows up to us and we hear about things, I'll be sure to let the center managers know. Okay? Thank you.
Thank you so much, Sherry, for that information. We just quickly want to acknowledge all of our panelists and thank you all for your participation, for taking the time out today to be with us and to share your insight, your perspective, and especially your time with us. So we have Melissa, who's going to come around and give you a sweet token of our appreciation, just for thanking you for being here today.
And let's give Lydia Pierre a very big hand. A big round of applause. Lydia and I go way, way back. Lydia was actually, she oversaw a program that my eldest son was a part of many, many years ago. That's when we first met. And when we started planning this town hall meeting, she was not even in our talk about reaching out to Lydia, but someone actually said to me, why don't you ask Lydia? And it just reminded me about how much she reared and took care of Tevin when he was in middle school. So this is like
show my age.
This is like such an amazing event, and I thank Lydia for taking her time. Lydia did pretty much everything for us. We didn't do too much of anything with this town hall. She put together the agenda, she put together script. So Lydia, thank you. And you're going to get a bag as a token of thank you. As well. You get a bag. You get a bag. In the bag, you just put some items from our senior services logo. There's a pad, a notebook with a pen. There's hand sanitizer, just some stuff so you can remember today. And thank you guys for supporting us and for being here and for offering your expertise. It's so, so much appreciated. Thank you.
Thank you. Thank you. As Melissa walks around and does that, we do have some refreshments and snacks in the back for you. Healthy snacks, of course, because that was the whole point, right? So if you don't take anything else away from here today, please remember to eat right and be cautious of what you eat. Pay attention to what you put in your mouth and eat properly so that you can be able to be healthy and live a quality life. Okay, so thank you all for being part of this. Please network, socialize, and enjoy. So thank you so much.